Good evening, everyone. Welcome to the Black Doctoral Network weekly web series entitled Conversation Starters. I'm your moderator, Fesse Longe, and I am thrilled that you could join us for tonight's topic entitled Caregiving During the COVID-19 Pandemic. This topic is extremely important during this time as we all can relate as COVID has affected us either professionally, personally, or in both realms. And to really dive into the caregiving aspect of COVID-19, we have two expert scholars that will help join this conversation. The first panelist joining me is Dr. Danielle McMakin, who is currently the Chief Advanced Practice Provider of Pre-Anesthesia Department and Senior APP in Surgical Critical Care Medicine. Her passions entail mentoring nurses, diversity, equity, and inclusion, anti-racism in nursing, and palliative care in the critical care setting. I welcome you, Dr. McMakin. The next panelist joining me this evening is Dr. Beverly Williams Coleman, who's currently the professor at U of L School of Nursing. She also manages a new clinic in collaboration with the dental school to treat patients with uncontrolled chronic illness and disease. And she also is practicing in optimal aging clinic, primarily focusing on the geriatric community. I welcome you, Dr. Williams Coleman. So I want to go ahead and get started with my first question that I have for you all is, what are the various types of caregiving? Dr. McMakin.
Thank you for that question. And I think that we have our traditional types of caregiving from home health care, assisted living, nursing home, adult daycare centers. But I think with, in light of the COVID-19 pandemic, it has exploded and expanded the definition of caregiving, where everyone at some point has had the opportunity to care for someone in some way, shape, or form, whether it's directly from home, doing some long distance care through telemedicine. So it's literally expanded the definition from the traditional types of caregiving.
Thank you, Dr. McMakin. Dr. Williams Coleman, do you want to add anything to that?
Yes, thank you for having me. And just like Dr. McMakin spoke of, a lot of it now has fallen on the families. For those that are still able or were able maybe to take care of themselves prior to the pandemic, but as the population ages or have gotten sick, now that role has fallen on the family, which has stretched that family dynamic greatly due to the pandemic. You still have your home care and your assisted living and your long-term care, which has posed its own issues throughout this whole pandemic.
Thank you. Well, you already started the next question that I have. How has the COVID-19 pandemic affected the caregiving industry? Dr. Williams Coleman.
Sorry, I got ahead of the game. So it has affected it drastically. Some of our older, the older adults or adult children that are now caring for parents due to either illness or those that have had to go to assisted living and or long-term care, and then that distress of them not being able to see them on a regular basis. With the aging population that I do see, that's been a big stressor. The parent may get ill, had to go to long-term care, and with COVID running rampant in some long-term care facilities in some states, that has posed a big stress on the family and on the patient, where it has led us down a road that we didn't expect, or you couldn't even plan for. So that's the biggest issue.
Thank you. And Dr. McMakin.
I would just say the pandemic, like it's done for other issues, it's literally raised more awareness and it's amplified the voices of caregivers. For so long, caregiving has kind of just been either something that you just are expected to do. And then there's pre-pandemic, there was already a host of challenges with caregiving within itself. But the fact that everyone has kind of been placed in the caregiver role in some way, shape, or form, it's elevated the importance and actually starting to normalize caregiving and what that looks like. And so, and I call it hashtag full house, because caregiving has exploded from not only elder care, but we have children that are virtually learning. So parents are having to adjust and pivot to, expand the caregiving to, oh gosh, I not only am taking care of elder adults, I also have children to take care of. And then it's also highlighted elements of, again, exacerbating uh, um, issues around like financial insecurity, highlighting how many reduced programs are already out there baseline, and then adding on the COVID pandemic, which shut down whatever respite and daycare facilities that caregivers had to kind of get a release from caregiving. And then also it's placed more stress on caregivers because of risk of infecting their loved one or being infected and bringing it home. And then with the delays of medical care, a lot of elder adults, have their routines, they have their appointments. And because the COVID-19 pandemic, it's caused delays in getting routine checkups, routine labs, physical therapy, all these type of kind of supplemental care aspects that help maintain some degree of functionality, mental acuteness for elder adults specifically, which has placed an onus on caregivers to learn extra skills. So learning how to do the range of motion, or learning how to get their loved one in and out of bed, bathing, clothing, feeding. So it's really highlighted kind of all the different elements that were already kind of at a deficit pre-pandemic, but now in the midst of pandemic, highlighting the importance of getting lots of policies, passing laws to help support, to give more resources for the caregivers in the world, because it's estimated there's about nearly 53 million people that are providing unpaid caregiving services. So.
No, thank you for that, Dr. McCamey and Dr. Williams Coleman. I think you all have really conceptualized this is a huge, huge issue. I mean, you all just touched on some of the aspects, but I just love how you all are able to highlight the different elements within the healthcare industry that, have been affected. So I thank you for that. So the next question that I have is, what are some social and psychological issues that arise from caregiving that impact the caregiver and the care recipient? Dr. McCamey.
So, I mean, the first one is just the stress of it all. I mean, we're all trying to survive a pandemic on top of keeping our loved ones alive, safe, well, healthy. And then you add that to whatever concerns, from finances, people losing their jobs, to losing insurance, isolation, from the social distancing, loss of support from neighbors and friends that could help supplement some of the caregiving roles and responsibilities because of the need to quarantine and socially distance. Trying to navigate between caregiver guilt, caregiver regret, because people are internalizing that they're unable to provide the same level of caregiving support pre-pandemic because of lack of, or reduced resources, I should say. So definitely the stress, the anxiety, the depression, frustration, isolation, all coupled in under one full house. So that's a lot of weight.
No, definitely. I agree with you, Dr. McCamey. Dr. Williams Coleman.
I can't echo that any better. She hit the nail on the head, because those are true issues, and the social isolation, the depression that has resulted in this in the caregiver on top of it. And then the caregiver that may still have to work outside the home. And like you said, just being anxious. What if I bring it home and then, who I'm caring for gets ill? So it's a whole gamut of issues that have come along with it that stresses the caregiver almost to the breaking point. In addition to the patient themselves. And then you have those patients, again, they may have been social butterflies prior to the pandemic, but now they can't get out and get to their friends. They can't do a lot of the things that some of the retired people do. and get out amongst friends, and they're feeling depressed. They're lonely. They may not be alone, but at the same time, they are lonely because they miss that interaction with their friends and other family members. So I couldn't have said any more.
No, thank you for that. And I appreciate you all highlighting that the COVID pandemic has affected people psychologically. And to that degree, the next question that I have is, what are some strategies to address and manage the mental health of the caregiver and the care recipient? Dr. Williams Coleman.
So just speaking from what I suggest to the patients and the families that I see, I definitely encourage them to, have game night, especially those that are older and they seem to have gravitated to that, especially card games, for whatever reason. And then I encourage them, if they have younger people in the home, like teenagers possibly, or school age, get them involved. Because again, they may not have been around that grandparent 24/7 like they may be now. So I encourage them to interact. Also, I always encourage them to look for online portals that can, help them interact. If, some of our older adults are very tech savvy. And where I work, we do have like a micro clinic where we can connect with those that may be having some mental health issues or some depression and just need to talk to someone. So I have that luxury of being able to refer someone right there in our office that just may need to talk to someone about what they're going through at the time.
No, thank you. Dr. McCamey.
Just to add, some of my colleagues say the important things are the focus on the 3 C's: connection, control, and cope. In connecting, just to echo my colleague, looking toward ways to connecting to your village. It takes a village. Now that the vaccinations have rolled out, we have a reasonable understanding of how to best protect ourselves. Caregivers need to reach out to their communities, looking for programs that provide respite, looking to the neighbors. Everyone has this spirit of wanting to help now, and what can we do to support each other? So tapping into those communities of resources to get some respite, some break, and some support. Control. As we all have learned throughout the pandemic, we have no control, but reframing our minds to focus on things that we can control. So setting expectations, understanding that, we're all trying to survive a pandemic, and that's stressful within itself. So recognizing that things aren't going to be perfect. Try to reinstill some of the routines that were lost pre-pandemic. So now we're all kind of adjusting to what our new normal looks like. So what is our new routines going to look like? We know with routines, we can have some locus of control. So capitalizing on those type of things. And again, asking for help. So that means relinquishing in a way, some control over some things that you sometimes may not have the energy or the mental capacity to kind of be at that level of support. And then cope. Tap into the mental telehealth resources. It seems like that has, again, the pandemic has highlighted the importance of mental health and the accessibility of mental health. So utilizing, there's tons of different telehealth resources, free mental health resources, taking advantage of trying to do some self-care practices, learning to communicate with others. And there's lots of different social media platforms, from Facebook groups to platforms like Caring Bridge, where you can organize people to help you bring food or help run errands for you. And then even just focusing on simple things, just grounding practices, just remembering things that bring you joy. And then just taking moments to appreciate those moments of caregiving being an honorable thing, and that serve a benefit for your loved one and also for you. So again, 3 C's, looking to connection, control, and finding ways to cope as best as we can to get through this together.
No, thank you, Dr. McCamey and Dr. Williams Coleman, for those great strategies. And I think our audience members definitely can relate to a lot of what you all have said thus far. And if you all are enjoying this conversation, please feel free to share, comment, ask any questions. These expert scholars are here to answer anything that you may have on mind. So moving to my next question that I have for you all is, what are some racial and cultural disparities currently present in caregiving? Dr. Williams Coleman.
So some of the racial and cultural disparities that these aren't new, they were already there. COVID has kind of brought them a little bit more to the light, which is, like Dr. McRamey said, our healthcare and telehealth. We're still, as African Americans, are behind the 8 ball with this telehealth and how to communicate that way, encouraging like mental health services, getting those mental health services, because again, as a Black community, we still don't, I won't say believe, but we feel like we can handle whatever mental anguish we have or mental distress we may have, and that we don't need to talk to anybody. And that's been a misconception for many years. So this isn't new. However, with the pandemic, it has made some things worse. And we have to encourage one another and encourage others to seek mental health. So in what I've seen in our community, that has been a big issue, is mental health. And suggesting people when to get help and to seek help. And now with the advent of telehealth, that has made it a little bit, I guess, when people don't see you come in the office, they feel like they're behind, protected a little bit. But we just have to get around that stigma and and let people know this isn't a bad thing. It's a good thing. We want you, to be mentally healthy. So that's what I've noticed as one of the biggest disparity. Also, which again wasn't new, with affordable food and food deserts, and now your kids are at home all day, feeding them all day, and people don't really think about that. So your grocery bill has exploded. You're having to go to the grocery more often. You don't have transportation, and again, even our bus system has reduced the number of time, the how late they operate, and have cut their schedules. So if that's how you depend on getting to the grocery store and getting home, and now that's been cut. So there's a lot of things that were already there. However, it has kind of moved to the forefront because of the pandemic, or not because of it, but the pandemic has really made it shine the light on some things that were already there. And so now, what are we going to do about it?
No, thank you, Dr. Williams Coleman, for that. Dr. McKamey.
Yeah, just to reiterate what Dr. Williams Coleman said, just the pandemic has really exacerbated a lot of the structural racism that's been inherent in our system and ever prevalent in healthcare, in individuals to access healthcare, access resources. And like I mentioned before, caregiving has always kind of been a silenced kind of space and hasn't really, the voices haven't really been elevated. And so with people of color, we tend to be communal and multi-generational households. So it was like mama taking care of daddy, so it's all of us in one. And so just to reiterate, the structural racism that has impacted access to resources has really been exacerbated in caregiving. And again, like we mentioned earlier, the food deserts, the financial insecurity has definitely put forth a hindrance in successful just health equity, health justice, and to be able to effectively care for our families. So just to reiterate what Dr. Williams Coleman said.
No, thank you for that. And I love how you all have really shown the light on how big of an issue this is. And like Dr. Williams Coleman stated, it's primarily these things have already been there. Like, again, COVID-19 has just brought them to the forefront. So thank you all for your responses. So the next question that I have is, what societal trends have increased caregiver stressors? Dr. McKamey.
Just reiterating kind of all the things that we've said in terms of caregiving not being at the forefront of people's awareness and all that entails in creating the stress of a voice being silenced and people not understanding the weight of caregiving. And so, and now looking to the baby boomers are getting older, so we're having an influx of elders that are going to need to be cared for, whether that is from traditional household caring or going to assisted living. So we have to look to that influx of people aging. How are they aging well? And how can we continue to support caregivers to help the elders age well?
Thank you. And Dr. Williams Coleman.
Everything she said and then some. And that's the thing about, like she said, the baby boomers are getting older. So while I'm taking care of my mother, I'm concerned who's going to, as my health needs to be attended to, who's going to take care of me. So that's an added stressor. And then, like she said, the caregiving, it's always been there. And it's like, oh yeah, you can get some help, but now, in light of this pandemic, you see how not so easy it is to get help for caregivers. And now it's made it even more challenging for that respite care. And then getting the family involved, because if there's more than one child or, more nieces, nephews, or whatever, and getting them to help and encouraging them to help. But that's easier said than done. So, and then if you're an only child, that's even more challenging. And like she said, you need the community, hopefully your family that you can call on, but not everybody has that. And I've seen it firsthand that there is no family they can contact to help them out, or they're estranged from the family. And you can see the caregiver decline as they're caring for the patient, the person 24/7. And as you see them in another 2 or 3 months, the caregiver is who I'm getting concerned about. And I'll just ask them questions. How are you doing? Because they can tell me everything about mom or dad's routine. And then I have to just stop and say, how are you doing? What are you doing to get a break? And sometimes I've had people stop and cry because I guess they really hadn't thought about it. Or then they're thinking, oh my gosh, somebody's actually asking me how I'm feeling. And it's opened up a Pandora's box that I was truly concerned, but then I had to back up and think, where am I going to lead them to get some help that they need and that they're crying out for, but just didn't say it. I just saw it all over them.
No, thank you for that, and for highlighting the reality that is caregiving on a day-to-day basis, especially, like you said, for families with multiple siblings, or just that one child that has to take on the responsibilities in addition to their own personal life. So I thank you both for answering that question. So the next question that I have is, how important are community resources for the caregiver and the care recipients? Dr. McKamey.
Oh gosh, community resources are the pillar of how we can get messaging and support to communities, especially communities of color, because like I mentioned earlier, we're such a communal people that we tend to find hubs of support, especially within our spiritual places. And then there's a whole host of community resources that can be engaged. And especially now, more than ever, the importance of having that community support to offload some of that stress. And some resources, especially in the area of mental health and respite care. Where can these caregivers go just to get a few minutes of peace, or pass off the baton to someone that they know is going to take excellent care of their loved one, so they won't have to worry or feel guilty about trying to take a break. So resources are key to providing that level of support so that caregivers can be successful in continuing to care and find that energy and passion to continue to care for their loved ones.
Oh, Thank you, Dr. McKamey. And Dr. Williams Coleman.
Yeah, same thing here. Finding those resources, and here where I am, I'm in the state of Kentucky. So there are some resources that we do guide people to. And again, I have an opportunity that I'm sure a lot of people don't have, that we have what we call flourish care specialists. And it's just that we want people to flourish. And so I call on them to get with the patient. What do you need? What is on your priority list? Is it, and usually it's respite care. So we try to definitely get the caregiver hooked up with that organization or resource to offer respite care. Definitely encourage other siblings to like you said, have a day to where you can have a break. And like Dr. McRamey said, that feeling of guilt is very strong, that because again, what she had said, the 3 C's, and control is one of them, because they're not in control for however long. And it feels like that, well, if I don't have control of it, something can go wrong. Well, you have to relinquish some of that control so that you can have that mental rest yourself. And that sometimes can be challenging for that primary caregiver. So that goes all along with it, but definitely checking with churches, like she said, in your community. See if there's community organizations in your area that can offer those, and then other state-run agencies that may be in your community.
No, thank you for that response. I actually wanted to expand upon that question real briefly with regard to resources. What can we do as individuals, patients, healthcare providers, anybody in any industry to continue to support caregivers? Dr. McKamey.
Well, rallying for policy changes. There's so much kind of focus on, there's not a lot of focus, I should say, on providing paid family leave for elder care. And I think, as I mentioned earlier, as baby boomers are aging, and there's going to be an influx of aging adults that are going to require care, looking toward getting some policies in where, FMLA does include getting some degree of compensation while you're having to take a break from work to get paid to take care of your loved one, your elder loved one. Looking at resources, one that comes to mind is called Arch Respite Locator. And that's a nationwide database where caregivers can plug in their location and find opportunities to take advantage of some of the respite sources. The primary care is also a good resource to start off with. A lot of patients have a lot of trust and connection with their primary care. So starting there to ask questions as to what available resources that they can tap into in terms of supportive care or things that are specific to the health of their loved one that they're caring for. Like Dr. Williams Coleman said, each state kind of has its own hub of community resources to tap into, getting connected with case managers and social work to help expand the search for eligibility for various resources that might be reimbursed by insurance, or getting just an expansive list of potential free resources. But a lot of this is dependent on that caregiver recognizing that they need help. And I can't express enough the importance for asking for help. I myself am a caregiver to my great uncle. He's in his mid-70s, and sometimes he can be a little difficult. So there's lots of negotiation and communication, but I'm thankful that I have a family support that we kind of pass him around. Right now, he's with my mom, so I'm getting my respite vacation from caring for my great uncle. But it is difficult to ask for help, because I've lived it. I've been in that place of grappling with, gosh, I need help, or I just need just one day. So I just want to leave this conversation with, if you're a caretaker, to, really just have lots of grace for yourself, and don't see asking for help as a sign of weakness or that you're passing off your responsibility. onto someone, but look at it as an opportunity for you to fill your cup so that you can continue to pour into your loved one through caregiving, because it's honorable work, but it's also hard work. And like I mentioned before, it takes a village.
No, thank you, Dr. McKinney, for those great points. Dr. Williams Coleman.
And she said exactly what she took it from me, is that caregiver recognizing and asking for help. Because again, I trip up on it in primary care, and you can just see it on their face. But sometimes we're busy and we don't recognize it and we don't ask. But that's the perfect place to ask for it. If someone's been hospitalized, ask the discharge planner, ask there's usually a coordinator for the floor or the social worker. Ask for that. But like you said, that's our biggest holdup is asking for help. And like you said, it's not a sign of weakness, but you do need that respite care, and let it happen, and take a breather, and then regroup, and then don't be afraid to ask for it again.
No, thank you. And I appreciate you both highlighting social workers and case management as being a very intricate part in the caregiving process, especially in the community setting as well as in the hospital setting. So thank you. Well, that concludes the questions that I have for tonight's topic, but I have one more question that I would love to ask you both. How has your affiliation with the Black Doctoral Network helped to enhance you personally and or professionally? Dr. McKamey.
I think I've been a member of the Black PhD Network for about 2 years now. And I'm a DNP, which is a Doctor of Nursing Practice. So when I first found the Black Doctoral Network, I was like, can I join? But I did join, and it's been such an enriching experience to connect to other Black scholars and expand my professional network and really get involved in some of the activities. And I just am grateful for the opportunity to have this discussion, to be selected for this discussion. And so I've definitely found a home within the Black Doctoral Network, and I'm so appreciative that I decided to join and have been involved ever since.
Thank you, Dr. McKamey. We love all your contributions and having you as a member. Dr. Williams Coleman.
So I've only been a member less than a year, and a friend of mine is the one who sent me the information and sent a link about it. And I said, well, let me try it. And like Dr. McRamey, I have a doctorate in nursing practice. And now I must have lost my mind, because now I'm going back to get my PhD, because I do still like that research aspect. And I do look at this as a network, like she said, to connect with other people out there, other people of color. What's going on in your neighborhood? Because likely it's going on in my neighborhood also. And how can we close this disparity gap? It's huge. And is it closing some? Possibly, but we still have a lot of work to do. And I find that this organization, there's topics from A to Z. And people from A to Z. So I'm so appreciative, and I have not contributed anything as of yet, because I'm still just kind of just looking around on the website, seeing some of these live features that you have, and just kind of seeing what's out there. And then I will connect it to maybe someone or something, and we can collaborate on something together.
No, thank you, Dr. Williams Coleman. I hope that the BDN will be very beneficial throughout your future endeavors as you pursue your PhD. So thank you both. Again, I just want to say a huge and tremendous thank you to you both for joining me this evening and having this very vital and critical conversation about caregiving during the COVID-19 pandemic, and really providing your expert insight on how real this is. Like you all have stated, you all are caregivers, and it is something that is going on. And like you said, COVID-19 has brought it to light. So I thank you tremendously for joining me this evening. So before we go, I want you all to take some time out just to provide some of the audience members with some contact information on how they can reach you. Dr. McKamey.
So if you're interested in following me on Instagram, I am at Dr. McKamey. I'm also founder and president of DNPs of Color. You can follow us there at DNPs of Color on Instagram and also Twitter.
Thank you. And Dr. Williams Coleman.
So I can be reached actually at the University of Louisville Traeger for Optimal Aging Center. That's where you can reach me. And I have my email in the chat. And I do have an yes, I do have an Instagram. And honestly, I don't use it very much, so I can't even tell you what my handle is. So yes, I apologize for that. But and I said I need to look that up. But obviously, it's not something I mess with very often. But I am on LinkedIn as Dr._Coleman 16 and on LinkedIn.
Thank you. And again, thank you for providing your wonderful knowledge, your expertise in caregiving during COVID-19. And to my audience members, if you have enjoyed tonight's conversation and would like to keep up to date with the latest BDN developments, please be sure to check us out on blackphdnetwork.org and become a member, or follow us on Facebook at Doctoral Network. Please be sure to share this live session with your friends, families, colleagues, and professional networks. I am your moderator, Fesse Longe. We look forward to seeing you next time. Have a good evening.